chapter 23. And this is part 2, guys, of our heart blood vessel information. And let's move on. I'm going to click along and show you some more details. Today, what we want to do is spend most of our time on the pictures. So I'm going to click through some of the language here that are in these notes. They're in your book. These are, we're just going to click through. So take a look at this picture. And I don't necessarily think you need to find it in your book, but guys, this just shows you the fact that our gastrocnemius muscles, our calf muscles, that's what they're really trying to show. It could be any leg muscle in the posterior leg, really, that's helping squeeze blood upward towards the heart, right? And it's an elevator type effect. We end up just normal muscle tone will help assist blood up against gravity. It's, especially when we're standing. So remember, there's some valves in those veins of the leg. They've got a lot of detail in your book about pressures of the chest and etc. It's more of a physiology, but so we're going to skip that. It's pretty interesting reading when you think about it. Here's a physiology graph. I'm going to just talk about it for a minute because, again, guys, where do the plaques form in our blood vessels? They form in the high pressure areas. So carotid arteries up by the neck, the coronary arteries, and the heart, right? And you guys have seen this. This is a picture that's also in Bio 115. And really, you can see how it undulates straight off the aorta, 120/80 if you're normal. And then as you end up with more pipes, capillaries, in other words, arterioles, capillaries, this is more of a sponge, you have low blood pressure. Anyway, that's more physiology. Let's kind of keep moving. Here's the one that we want to really spend a little time on. The picture of the arteries. And let's just kind of make a little list. We do see bigger pictures later that are more useful to look at the specifics. This one would be like the beginning. And let's just kind of start over here on the left of the picture. We've got a right common carotid artery. And that is a common carotid whenever it's one pipe before it's split. Okay, so when you look at the cat's neck, you're really going to find the common carotids. If you were to dissect way up into right by the jaw, you would see the external carotid and the internal carotid. So the internal carotid is what goes into the brain. External carotid goes to the exterior of the face. We see, here's a new one for you, brachiocephalic trunk. Okay? If we were to zoom in on the aortic arch really close, the very first artery that's large is the brachiocephalic trunk. Because remember, we do have two small coronary openings for the coronary arteries. Like if you think about the aortic valve, the aortic arch, the first two little holes for arteries are the coronary artery openings for the right and left coronary artery. But they're not very big. And that goes to the heart. So the very first blood vessel off the aortic arch that goes to the body would be the brachiocephalic trunk. I call it the BCT. The brachiocephalic trunk, and then you have the second one, and we're going to see a bigger picture later, but if you think about it, the second large vessel right above that red dot is actually the left common carotid. And then there's a third one, which is the left subclavian. So if we think about right in here, off of the brachiocephalic trunk, we have the right subclavian and the right common carotid. That is, guys, there's a lot of little detail here. The reason why I emphasize this is because at the hospital, people do introduce different, drugs into the subclavians, definitely, subclavian arteries, subclavian veins. If you really wanted to get certain blood gases, sometimes they'll go for these vessels. There are people who can find them and go introduce different objects into them. So BCT goes into the right subclavian. Let's follow that subclavian down. So the subclavian is just under the clavicle. You can see how it barely goes under the clavicle. And then as soon as it gets into the armpit, it is the axillary artery, because the axilla means armpit. So it's just, if you think about it, it's the same pipe, it's just different names based on where it is. Then after the armpit, we have the brachial artery. And that one's pretty easy because, you know, biceps brachii, brachium. The word brachium means humerus, so it's right there in front of the humerus. The brachial artery then is going to bifurcate, which means split into two, and we see a radial. Guys, it's kind of, this picture's not very big, so it's hard to see, but think about it. The thumb, radius side, radial artery. Over by the pinky, that's the ulnar side. We call it the ulnar artery. There is a median, but we don't see it labeled. Palmar arches. There is basically a loop that connects. It's an arch in the hands, and it's in the palm, so they call it the palmar arch. So really, most important to know, brachiocephalic trunk, subclavian, axillary, brachial, radial, ulnar, right? And going back up to the carotids, we're going to see a better picture of the neck, so we're not going to talk about that in detail right now. We'll see a better picture in a little bit. All right, so aortic arch, and let's go inferiorly. We have aortic arch going behind the heart, so they're calling that the descending aorta. And guys, we're going to see a bigger picture later, but right now, that little dot, that little red dot is on the celiac trunk. Just memorize, this is a good one, guys. Celiac trunk is the biggest blood vessel to the stomach and the liver. Like really, if you were to think about how do we feed the bowels with blood, the celiac trunk is the first one that does that. And so it doesn't have a lot of details labeled here, but these little bitty vessels that are kind of like hanging out there, those would be hepatic arteries, because the liver's over here. If we look, we can see another little opening. Well, you can always think about, guys, we know the renal arteries go to the kidneys, right? We all should remember the kidneys have renal arteries. And you can see them right above this yellow or red dot. If you look on the anterior of this vessel, you can see an opening below the celiac trunk that's labeled superior mesenteric. And really the best answer for where that goes is the mesenteries, which what are the mesenteries? They're bowels. We'll see better pictures in the future, but I just wanted to show you, it is on this picture. And then there's an inferior mesenteric.
Okay, so does the celiac trunk send blood
to the upper part of the digestive system? Like you really could think of it, guys. Celiac trunk is the upper 1/3 of the digestive system. What's up there? Stomach, liver. The superior mesenteric would be kind of like more of the middle of the bowels. And then the inferior mesenteric is more of the like rectum and lower 1/3 of the bowels. And it's not perfect that way because you're going to see pictures come up. There's collateral circulation that makes it complicated. But that's the big idea. So I'll tell you what, we'll repeat this. We'll repeat it when we see better pictures. But so abdominal aorta it bifurcates into the common iliacs. Guys, remember your ilium is that hip bone. So as soon as the abdominal aorta bifurcates, we have a right and a left common iliac artery. And as that goes down inferiorly, we would have a internal iliac, which stays in the pelvis, and then we would have an external iliac that actually is the one that will go down and turn into the femoral. So we could say that the external iliac artery gives rise to the femoral artery. And then the femoral artery gives rise to the popliteal artery. So guys, remember the popliteal artery, it's named that just because the back of the knee is called the popliteal fossa. So femoral artery turns into the popliteal. And then down in the leg, we have an anterior and a posterior tibial artery. The one that's anterior is in front, posterior is in the back. So before we switch slides, let's kind of see if we can see any more details that we haven't talked about. Honestly, we're gonna see pictures come up as we go that are better. You know, this is the big idea that's kind of hard to see all the details. Now, take a look at the veins, okay? What are the names of the veins? If we were to think about like the popliteal artery, the popliteal vein. So usually the vein is the same as the artery. Very often. You know, we have a posterior tibial vein, anterior tibial vein. There are some names that are different for veins that, like, we do not have a great saphenous artery, okay? But the great saphenous vein is back here. It's on the more of the posterior. It's hard to tell, but that's on the back of the thigh and the leg. This is the famous vein that is harvested for the cardiac bypass. I have a friend at the hospital. That's what his job is, to take that out of patients before their heart surgery. That's what he does that all the time. And it's kind of amazing. So just memorize, great saphenous vein is back there. It is not the same thing as the femoral vein. The femoral vein is definitely larger. You definitely don't want to lose your femoral vein. You'd need that. The greater saphenous, you can take it out and you can typically be fine. So again, when you think about these names, that's one exception. When we go up here to the neck, there are definitely the jugular is an exception. Nobody ever calls it the carotid vein. You know, the jugular vein is synonymous with the carotid vein, but nobody uses the word carotid vein. They call it the jugular vein. And very similar to the carotids, you know, there is an internal and an external component of it. But really, guys, we can kind of keep it simple. There's a left jugular vein and a right jugular vein. There is a right subclavian vein and a left subclavian vein. Now, when we think about blood coming up the brachium, the arm there, or this extremity, let's just call it the upper extremity, blood is coming back up. Oh, by the way, the ring finger, the left side. Why is the ring finger on the left hand? Because it's closest to the heart. I don't know, have you guys heard this story? It's like a romantic thing. The left hand is closer to the heart, so the ring finger's on the left hand, and actually the fourth digit has technically the most return blood flow towards the heart. So the ring finger is the closest to the heart. That's why they picked that fourth left finger. So blood's coming up, and, you know, when we get into this subclavian vein, it's just going to arch into the superior vena cava, right? Going into the superior vena cava, back to the heart, like we mentioned the other day. So I will say the median cubital vein, the reason why I want to mention this one is the cubital fossa is the front of the elbow. So that's why they call it the cubital vein, because it's in the middle of the cubital fossa. And people who do venipuncture, that's one of the ones they tell you to try to find. So you'll hear about the median cubital vein quite often. The cephalic vein, guys, you don't have to label these, but, you know, this vein is very superficial, so you can see it on an athlete oftentimes. It'll be one of the first ones to kind of show whenever people get real lean. And so the cephalic vein goes towards the head. That's why they call it that. Also, the basilic vein, that's a little bit bigger and it's deeper, but another one that, you know, you might not have heard of, the basilic vein. You don't have to, there's no specific test question on that, guys. But it's kind of good to look at it. If you look over on the side, the gonadal vein, and the other picture had a gonadal artery, actually. You know, we were on the other slide, I didn't mention it, but gonadal artery, gonadal vein. Guys, I just wanted to mention, because you did that fetal pig drawing in Bio 115, and it actually did have those vessels on that diagram. And they come off up high. Like, if you think about, for a man, the testicles are down here, the gonads, and for a female, the ovaries are kind of right in there. So for a male, these gonadal vessels are actually really, really long. They're like a foot, you know, I don't know, you have to measure it, but they're pretty long. They're very, very small. Think about a little bitty artery going to just one testicle, and the artery's got to be about a foot and a half long to get there. And really, because male and female anatomy, if you think about it, it's very similar. The origination points for our gonadal vessels are at the same location up here. All right, so let's keep looking at some bigger pictures when we move along. Yeah, this is a great slide, guys. Okay, so test question. What is the vertebral artery? Okay, well, if we look at the starting point here, brachiocephalic, this would be like the brachiocephalic trunk. I would say test question, the vertebral artery here is the one that, if you look closely, it's running in the foramen of the transverse processes of the cervical spine. And if you look at the upper area, you can see how this vertebral artery takes a 90-degree turn posteriorly. Boom. It's going up and 90-degree bend. Then it has to kind of curve around. It ultimately goes into the skull, guys. It's hard to tell, but this one does supply 10% of the brain. You know, this right side here supplies 10% of the brain. The carotid, which is here on this right side, would be 40% of the cranial circulation. So, you know, that would add up to 50% for this side. So really, what's going into the brain is coming from the carotid and the vertebral artery. Oh, let's see. As far as other specifics, guys, you don't have to label these things, but, you know, some of the names kind of make sense. You know, superficial temporal artery, this is on the temporal bone. It's superficial. Facial artery, you know, we're not going to be facial surgeons, but, you know, lingual, that's for the tongue. Lingual, that means tongue. Thyroid surgery is very bloody. When we get to the endocrine chapter and we talk about thyroid, surgeries, there is a lot of blood flow to the thyroid because of the hormone. You got to get the hormone in the blood, thyroid hormone. So we have thyroid arteries, but again, that's just FYI. Going and looking at the structure here of the veins. Is there a vertebral vein? Yes. Basically, if you get blood somewhere, you got to get it back. So there's a real specimen. I was going to show you some stuff. Guys, honestly, on a human, that this looks like spaghetti to me. Like whenever I dissected the necks of humans, I thought of spaghetti. Like this is a very clean dissection, and it still looks quite involved. I was going to look for the vagus nerve, and I don't see it. Maybe one of these threads here, but anyway. Okay, test question. What is the circle of Willis? Okay, this is a great picture showing us the problems with the cranial circulation. Actually, tell you the truth, there was a backup feature, guys. Okay, so this is the inferior of the brain. It's a little tricky at first. Basically, this little area here is the carotid artery going into the head. And so is this. And so we see a circle around this area. It's called the circle of Willis. It'll be in your book. I don't see it labeled on the slide. Well, yeah, there it is. Circle of Willis. Willis. Famous place. And here's the circle, a little bit easier to see. Basically, what this means is if you were to have a completely blocked anterior cerebral artery, like if that red dot right now was a clot, you could still get circulation everywhere you needed because the blood can go in a circle. It'll just go faster around one way. Right? Does that make sense? You know, if you had a blockage here at this posterior communicating artery, well, you would still be able to get blood, you know, all the way around. Now, so the circle of Willis helps with the more pipes, the better, right? The other thing that I want to mention is because we talked a little bit about cranial nerves on the eye already, and again, we'll repeat those things later, but the reason why the cranial nerve function is so critical is like these are the cranial nerves. You got a lot of them. You know, here's the pituitary gland and the optic chiasm of cranial nerve number 2. So that's the optic nerve right here. The olfactory nerve number 1 right there. So think about if you had a blood vessel that began to kind of become larger, like an aneurysm, it could affect cranial nerve number 2 very easily. It could affect other cranial nerves very easily. So that's why the cranial nerve functional tests are so commonly done to rule out aneurysms or pituitary tumors of that region. You can have a pituitary gland get bigger and cause problems. My wife's father went fishing about 10 years ago, and he was walking away from the lake and fell backwards, straight backwards. They don't know what really happened exactly. They don't know if he had a stroke here, the basilar artery here that goes to the kind of like the brainstem region. They don't know if it was a stroke that caused him to fall or if when he hit the ground he had a stroke, a hemorrhagic stroke of this blood vessel. But ultimately, his injury that day, the events, he was brain dead after that, a couple days later. So, you know, the basilar artery, I would know that. It's kind of like to the base, the brain stem. You can see the medulla. Guys, this picture is kind of tricky to look at, but here's the spinal cord. Here's the medulla oblongata in this region. You can see on this side here, they've kept the cerebellum intact. Like this is the cerebellum. Over here, they removed the cerebellum to show like where the deeper blood vessels can go. You know, so there's a lot going on in this picture. The most important thing is circle of Willis. Now, on a test, think about the frontal lobe. If you were to have a blocked, like this little code here, you know, and what are these blood vessels up here? Anterior cerebral arteries. You know, like anterior cerebral arteries go to the frontal lobe in simplest explanation. Middle cerebral arteries go to the temporal and the parietal lobe region, right? In general sense. The posterior, they're listed over here too a little bit. The green ones, look at them wrapping around. So right here. So here is a posterior cerebral. If you had a clot form there and that shut down this part of the brain, you're going to lose a lot of vision, right? The occipital lobe deals with vision. And, you know, we're keeping it simple, guys. Neurologists, they know all about it. But the circle of Willis is a good feature. So make sure you know the circle of Willis and have the general idea. If a blockage occurred on the frontal lobe, it would be anterior cerebral. And guys, remember, cerebral is the big brain, cerebellar, which we don't see any of these things talking about cerebellar, but these would be cerebellar arteries going to the cerebellum. The cerebellum is the baby, like the bell of the brain. Guys, just for fun, we're not going to ask any test questions about this, but hey, we get blood to the brain, it's got to get back to the heart. So this is like foreshadowing. You can see a very large sheet here in between, like down the sagittal region of the brain. the brain's been removed, and this is where the right and left cerebral hemispheres are separated. So we have some sinus return. You can see like a superior sagittal sinus. We're not going to get into details on this, but ultimately these sinuses, how do you like all that business? The cavernous sinus, kind of in the middle of the brain. This returns into the jugular. So yes, there are definitely a lot of different places where blood goes back to through the brain. Okay, good. Guys, here's a zoomed in picture somewhat. We'll actually see more of them. And by the way, don't panic when you see these kind of pictures, right? We do not have to memorize all of these arteries. But again, look at this. Anterior intercostal arteries. Guys, intercostal arteries, these would be taking the muscles to your baby, or taking, the baby back ribs, right? The intercostal muscles are the ribs. The artery to the rib muscles are called intercostal arteries. But more specifically, I wanted to show you celiac trunk right there. Superior mesenteric right there. Inferior mesenteric. We will find this on the cat. It's very easy to find, guys. Well, on purpose, I like to show you that because it's cool. We talk about it here. We're going to find it on the cat. You guys on the pigs found renal arteries and veins, right? You'll find those. If we go right in between the, the kidneys, we can pretty much figure that first pipe right there is going to be the superior mesenteric. So, that just kind of shows you a little bit better detail. Now, I got to tell you an interesting story about this. Here we have a kidney, renal vein. Guys, this picture is not showing the ureter in detail, but you got to remember, off of the kidney, we have a ureter that takes urine away from the kidney down to the bladder. There's a condition that's pretty rare, and I can tell you that I've been reading about it. It's called nutcracker syndrome. Okay, so if you think about a nutcracker, you have this plier thing and you smash a nut and it opens the nut, right? Well, nutcracker syndrome only occurs on the left side of females. And it occurs if they've had multiple babies and they're skinny. And ultimately, what happens is the renal vein and the gonadal veins that are in this region, they smash on the ureter so much that the pee can't get out of the bladder. It's like a blockage, and it causes the kidney to back up. It's kind of interesting. When we talk about gonadal and like if you think about your vascularization of this region for pregnancy, guys, whenever a female becomes pregnant, all of the blood vessels increase in size down there in this region. It's amazing. If we see a pregnant cat, you're going to see a whole lot of blood vessels down there. Anyway, so that's just an interesting little thing. Nutcracker syndrome, pretty rare though. There's a real specimen. Lots of stuff going on there, but let's kind of keep moving to the easier pictures. Oh, and take a look. They zoomed in even more. So, guys, I can guarantee you on the test, celiac trunk, where's it go? I said upper stuff. So this is the one that really is the best to talk about it. It says right here, celiac trunk and its branches. There it is. So, and guys, I will tell you, I looked up, can someone have a complete blocked celiac trunk, like a heart attack of the celiac trunk? Yes. If you do have that, and I've talked to people who have dealt with these patients, it's pretty rare. Basically, you know how a heart attack limits your cardiac output, right? Because your heart muscle's compromised. If you have a blocked celiac trunk for any moment of time, like more than a few minutes, you are basically going to have complete loss of your stomach and liver within a couple days. Right? It's probably, there's just, your digestive function shuts down. And typically it's not, you have time to plan a little bit, but it's very rare. We see our duodenum here, our pancreas. So this does supply the pancreas. It supplies, guys, gastroduodenal artery. That would be basically celiac trunk taking blood to the, like I mentioned earlier, the top 1/3 of the digestive system. So the duodenum is in there too a little bit. And you can see even the splenic artery. The spleen would be affected. The term here, gastro-omental artery, you guys have not seen what the greater omentum looks like yet. That is definitely something that's up there. We'll talk about it more later. So here's why, okay, take a look at this. This is a nice slide. Superior mesenteric is here. All they're wanting to do is show how the mesenteric circulation connects. And we do not need to know all of these arteries. Just know that the superior mesenteric basically supplies, look at this, if you think about it, it goes down, and it definitely shows in the picture this cecum, the ascending colon, the transverse colon, the descending colon, the sigmoid colon. Man, this thing, if you think about it, you got to be careful. Here's the inferior mesenteric here. So if you were to assume that blood isn't going to go around this very much, and this is going to have more blood pressure here, which it does, really, the inferior mesenteric is more specific to the sigmoid and rectum and the, most of this descending colon. But we have connections. Also in this picture, guys, look, right here is where they sliced the small intestines. Actually, they sliced it at the duodenal jejunal flexure, which we'll see later. You can see this is a little bend right here. So this is the duodenum, and then that's the beginning of the jejunum, and they call that the duodenal jejunal flexure. So they've sliced that, and they've removed the jejunum and most of the ileum. Here's the ileum. So you don't see all of the small small intestines. That's what these little bitty tributaries are going to. And all they called it was intestinal arteries, right? So superior mesenteric is also powering most of the small intestines. If we look at the inferior mesenteric, we don't see that. So I don't know which one's most important. Probably celiac trunk. Definitely superior mesenteric, or those two together are very important. Could you live with a shutdown? Like, what if you had a blocked inferior mesenteric? It would affect half of your large bowels. So that would probably be the least catastrophic. Interesting stuff, though. Here's our appendix on the tip of the cecum. We have our ileocecal valve in here. We'll see that later in another chapter. But that is the detail of the superior and inferior mesenteric. Technically, there's like 30 some odd arteries in here. We do not need to know all those. It would make us dizzy. Okay, so we just looked at how to get the red blood in, right? We saw red pipes taking red blood into the bowels. Now we've got blue blood. So this picture is kind of like what we just saw. And I love this picture, guys. It has something very meaningful staring right at us. Think about it. We chew our food up to get the nutrients out of our food. So the intestines have now absorbed the food stuff we need. This blue blood is very, very rich in vitamins and carbs. It's rich in our foodstuffs. But it's been deoxygenated because the cells of the bowels have used that oxygen in the blood. So what do we need to do with our food pieces that we spend so much energy digesting and absorbing? We need to take it straight up to the liver. And so this thing right here is really important. The hepatic portal vein. Guys, this is the blood going into the liver with a lot of good food parts, amino acids and all that stuff, right? hepatic portal vein. Now, guys, we all know that like hepatitis is a liver problem, and we've probably all heard of alcoholism affecting liver. You can get what you call hepatic hypertension. Seriously. Basically, if your liver starts scarring up, what happens is the cells, and we've got another picture coming up in a minute that shows like blood going through the cells, but this thing becomes blocked. And so when blood tries to get into this, it can't get in. And that's what you'd call hepatic hypertension. And they actually will, for very end-stage hepatic hypertension type deals, they will shunt blood around the liver. You've got to get blood into the liver so the liver can do what it does. But at the worst cases, they can shunt blood to help with blood flow, because you cannot block this. You block this, you're going to die. So you cannot have a blockage occur here. And it's kind of like a pulmonary clot. You know, if you think about blood flowing, it's real easy for blood to flow through big pipes, but when it goes to an organ like the lungs that's like a sponge, blood has to spread out and it cannot go in a clot form if it was clotted. So the clots will occur right before the major organs like this. Not good to have that happen. So hepatic porthole vein, where does it get its material? Off the mesenterics. You know, the mesenteric vein, there's a superior and an inferior mesenteric vein, so pretty easy. Spleen is splenic, so there is a splenic vein. Guys, you don't have to know all the little nitty-gritty details. I just kind of have a big idea. Nutrient-rich blood from the bowels is going to come up the superior and inferior mesenteric veins into the hepatic portal vein and go to the liver. You do see in this picture way up top, and if you go way up here by the diaphragm, we see the inferior vena cava, and we see actually hepatic veins. So, you know, these veins are leaving the liver, going towards the heart, which is different. You know, you could see how a test question would be worded, guys, maybe. Which veins take nutrient-rich blood into the liver? And if you had choice A, hepatic veins, that would not be correct, right? Choice B, hepatic porthole vein. And there's only one major piece. So that would be the best answer. And isn't this fun? Fun stuff, isn't it? Let's look at more pictures. That's too much detail there. I don't know, guys, like, we've already kind of looked at this. Here we have the upper extremity, a little more detail. You know, subclavian, axillary, brachial, down into the right and left, which would be ulnar and radial. So let's kind of keep moving through these. I want to show you. Anyway, so same thing here, guys. Look at these pictures and help kind of get a general sense of where the femoral is, popliteal, anterior and posterior tibial. There is a fibular artery too. You know, that's a small one on the side. I'm going to show you guys something here that's really cool. I might have played it for some of you guys. Ooh, guys, after this slide, and I just went quick. Look at this piece. Femoral triangle here. This is actually really pretty cool. We see the inguinal ligament, this thing that's been pulled with a fork. You know, that's a little curved fork to pull it. Here's the sartorius. This muscle here is the sartorius. So this is the femoral triangle, and we see the femoral vein, we see the femoral artery, and we see the femoral nerve. A lot of times in anatomy they call it navel, N-A-V-L, nerve, artery, vein, and lymphatics. So they did not show the lymphatic lymph node in here, but there is a lot of lymphatics that they've dissected out here. And we also see the spermatic cord here, so we know it's a male. Definitely, if it was a female, we wouldn't see a spermatic cord there. So this is the femoral triangle. You can see how all those structures are kind of, and there's the greater saphenous vein going up to the femoral vein. Guys, if you're a meat, like a person who works in a butchery, they are required to wear metal aprons because back in the old days, people have died from accidentally slipping and cutting their femoral artery and vein with a butcher's knife. You know, you've got a big slab of cow meat on a table, like at the lab room, and you're just putting pressure and you're trying to make a steak, you know, whatever size. And if you slip, it is not, guys, this, you don't feel a femoral pulse. Like, I don't know if you've ever tried. I never can feel my femoral pulse. It's a little deeper than being able to palpate, but if you had a sharp knife and you poked in there in the wrong spot, you're going to have a few minutes. You know, the bleed is very quick. So that's just kind of cool. All right, so let's, you know, that it's not cool, but it's like a state law. I think that it's a state law that butchers have to wear metal aprons. Anyway, so I'm going to try to play this. Guys, this video I've played for many times. I keep talking about clots and loss of function of different anatomy regions, mainly because it helps you know where the artery goes. Technically, any clot's bad anywhere, right? So let's look at this. Let's see. You guys you're already wanting to look up Snoopy or something. Let's see. Embolism, cardiac embolism surgery. I can't spell when I'm doing this quick. Yeah, this is the one that always comes up. This is the one that is just, guys, the doctor, I love the way he talks. We're gonna watch this real quick. Let's get
This is a case of an acute pulmonary embolism from a deep vein thrombosis. Here we're performing a pulmonary thromboembolectomy using retrograde pulmonary vein perfusion. Here we've established the patient on cardiopulmonary bypass. A arterial line is placed in the right superior pulmonary vein, as seen here. This is wide off of the arterial cannula and clamped. As you can see, the clamp is in place. We are on full cardiopulmonary bypass support. The next step is to apply the aortic cross clamp and achieve cardiac arrest. Here we're performing the pulmonary arteriotomy with a knife and then scissors, and you can already get a glimpse of the thrombus inside the main pulmonary artery. As it branches, you can see a grasper is used to remove the thrombus. This is a very large saddle embolus that originated likely from the patient's femoral and iliac vein. She had a fracture of her right lower extremity, was in a cast, and this was likely source from the right leg. You can see the embolus is removed. A Fogarty catheter is used to clear any further clots, which none are found. Then at this point in time, we take the clamp off of the right superior pulmonary vein cannula. This allows us to perform retrograde pulmonary perfusion. Goes from the pulmonary veins back through the lungs and out the pulmonary artery, as you can see here. Small emboli and air are cleared, you can see in this portion of the video. Once we're satisfied that the pulmonary arteries have been cleared of debris, and we ventilate as well during this process, once we're satisfied with that, we'll stop the retrograde pulmonary vein perfusion. We'll inspect with the thoracoscope. You can see here the small branches of the pulmonary veins are cleared. The main trunk of the pulmonary artery is also clear, and we inspect the thrombus one more time. You can see this is a very well-formed thrombus that is soft. Anyway, and that ends the case. The patient has done very well following the surgery.
So anyway, that gives you an idea of how big a clot can get. And a clot buster medication would not take care of that. There is something called TPA that's a clot buster, and it's used sometimes, but it will not eat up that kind of deal there. And so they surgically removed it. I was going to show you where that was. It's kind of hard to keep track of all that business. Anyway, guys, it was right before the lungs. You know, if you think about a clot going up the inferior vena cava into the right atrium, into the right ventricle, and then out the pulmonary trunk into the pulmonary artery right before the lungs, and it clotted up as big as a hot dog, right? And they surgically removed that. And the person lived because there's two sides. They could still ventilate. They were able to breathe with one side that was working. Anyway, let's look at another pipe. Let's talk about another real specific test question that's a pipe. And it happens to be a lymphatic pipe. Okay, guys, I know I'm kind of clicking through these a little bit. It's in chapter 24, they talk about it. And like, there's a picture, if you have the book, it's like right in the very beginning of chapter 24. We don't, if you think about it, we just a moment ago looked at our femoral triangle region, and I said that they had taken the lymphatics out. So what I want to do with this chapter is just mention that we've got these lymphatic vessels that go back to the heart ultimately. And like, this is the most important thing to think about. It says if you look at this normal flesh-colored body, so we see left face, left chest, around the diaphragm, down, everything is going to be drained by the thoracic duct. Okay, so this is not a vein and it's not an artery. This thoracic duct, they named it that because it is right on the anterior of the thoracic spine. So here's like a real dissection, and you can see that, laser pointer, that thing right there, this duct. And if you follow it up, it's a little bit tricky. It's kind of funny here, but you can see it's labeled right there. Where does it go? It goes into the left subclavian vein. So guys, this is the one, if you think about this duct, this is taking dead immune cells away from tissue of the lower body and dumping it into the veins. And so from that point, it's going to go through the veins and really the whole body, and the liver is going to clean out the nasty, wasteful cells. Guys, it's basically pus, right? If you think of this carrying zit fluid all day long, and it's going at like snail pace, it's not very pressurized, and it has to get out of the body. So it's going to go into the left subclavian, and then through the blood flow of the whole body, really. And as it goes through the liver, it will be detoxed. It's important to talk about this because, guys, honestly, this summer, some of you guys, well, no, it was last fall. Guys, I had a lymph node in my inguinal region that was as big as an egg, okay? I went and had a CAT scan for this thing. The CAT scan, that trip to the ER cost about $8,000. This was last fall. I was worried I had a hernia, and I went and got looked at, and it was a lymph node. And I can tell you, I got a little bit into the idea. Guys, as soon as you get a lymph node that swells up like that, you have to wonder what's wrong, right? Is it an infection? Or is it lymphoma? Or is it cancer? And I will tell you, we're not going to study all the lymph nodes, but colon cancer is so common. And I will tell you that the colon does drain into this femoral inguinal lymph node. And so that was I was like, oh boy. Now I ruled it out. I thought about why I got it, and I'm not going to tell you the whole story, but it was it turned out to be okay. But it took probably about 2 or 3 months for that lymph node to reduce in size. I even had a surgeon scheduled to biopsy it to see if it was cancerous. But because it started shrinking, I canceled that appointment. We talked about it. Anyway, so if you were to have cancer in a lymph node, ultimately it will migrate into the thoracic duct if it's coming from below and get into the bloodstream, which that's where you get metastatic cancer to all the hollow organs, especially like bone cavities, right? The medullary cavity of bones, lung, liver. That's where you get, that when you look at survival from cancer, if you get the cancer removed surgically before it gets into the lymphatic drainage, you are much, much more likely to have a good outcome. And so anatomically, this area here is not going to be thoracic duct. This would be the right side, so right upper body, right upper body. That's what I would describe it, right side, upper body, right extremity, upper extremity, I should say. That area doesn't go to the thoracic duct. It actually goes to just the right lymphatic duct, and the right lymphatic duct also dumps into the subclavian, but we don't really see that detail. So just a little different pathway anatomically. And I will tell you guys, this duct has smooth muscle in it. The thoracic duct has some smooth muscle. There is peristalsis, which is the motion of fluid in a tube. There are some research projects that have looked at this duct, and if you stimulate its contraction, it will help healing. How do you stimulate it? You pop the back. If you pop the back, you can cause that to have spasm, and it helps move the flow. Anyway, so guys, this is chapter 24, and we are not going to go through this chapter in detail. That is the only thing that really we need to know. And I would say we've seen something like this before in our tissue chapter. It just, in the capillary chapter of chapter 22, I think showed us this kind of setup. So that really is the end of some of the pipes for today. You guys are all